Well, the cannabis industry has been booming since a law changed allowing for the private growth and consumption of the plant. Concerns have, however, been raised around the health risk involved with indulging in the tree of life, as many call it. Professor Zuki Zingela from Nelson Mandela University joins me now to discuss this further and tell us about the effects of marijuana and her concerns. Prof, thank you so much for your time this morning. A very good morning to you. They always say that too much of a good thing is quite bad. When it comes to cannabis, though, just how bad is bad?
Thank you so much, Faith, for having me. I think our biggest concern are the public health implications of rampant use of cannabis without any checks and balances, because we know that the young brain, when exposed to cannabis, does not develop normally, and it does predispose, young people to ongoing mental illness as they get older. And more importantly, there are other risks associated with cannabis, which include impaired driving, when you are supposed to be driving with a clear mind. That can also affect the rate of accidents. And then more importantly, there are also other complications which relate to how the cannabis is then taken in. So, for example, risks associated with smoking. And one also has to remember that more recently, there's been a study published that indicates that if you smoke cannabis regularly, or if you smoke cannabis before surgery, it affects your ability to respond properly to the anesthetics or medication used to put you under during an operation, and it can also affect your recovery. So there's a number of public health risks that are concerning when it comes to the use of cannabis. And more importantly, more recently, with countries that have also legalized cannabis, there has been a trend where the labeling of the products for cannabis is not done in an appropriate way. So a substance containing high concentrations of cannabis can easily be labeled as having low concentration of cannabis. What that has done is there has been an increased number of children who've been admitted with accidental poisoning because of this mislabeling. So there's a number of public health issues that are concerning, and that therefore demands that any country that's going to be allowing use of cannabis specifically for non-medical and non-scientific use has to take responsibility for managing the public health risks as well. Not to mention that countries that do so are going against the United Nations conventions on how controlled substances are then traded in.
Yeah, but then how then do you just start translating this message, Prof, in a practical manner? The fact of the matter is we say that smoking causes cancer, right? Liver cancer, lung cancer, or the like, and yet we still have smokers. And we've got people that smoke in front of children. We've got people that smoke. We've got people that have got an addiction to smoking and the like. We're saying here that cannabis can have adverse effects and actually long-term effects in terms of even your mental state, which is quite critical. How then do we start filtering down the message so that people don't look at these messages, look at these warnings and say, just another one to scare us off the holy herb?
That's actually a very nice and well-put question. I think part of the responsibility here also lies with government. It also lies with National Department of Health. It also lies with Departments of Social Development, who are all the different sectors that have to play a part in the messaging that the public out there hears. Because currently we have a situation where, a controlled substance like cannabis is trivialized in terms of its effect on the public health. And therefore, it becomes the duty of everybody who is involved in protecting, the public in terms of public health adverse effects to, filter down that message. And the message is very clear. You should not be having anybody who is young who is exposed to free use of cannabis. And the reason is because children will copy what they see, first of all, but more importantly, children will also tend to absorb the message that says cannabis is, not posing a significant health risk if my mom or dad are doing doing it. It's similar to other behaviors when it comes to addictive substances, and you mentioned smoking. So more importantly, that message has got to filter not only to adults, but also to children, because as we said, the growing brain is the most vulnerable in terms of the effects of cannabis. And what we are then therefore saying is that when you look at the use of cannabis, there are prescribed and very specific reasons why people would be using cannabis. One of them is for medical reasons, which means it has to be prescribed by a physician. And more importantly, the other one is the fact that if you then look at the free access to cannabis, there is a potential for harm, as I mentioned, for children who unknowingly will ingest high concentration of cannabis in what we would view as edibles. And what is also concerning to us is that industry is, which is trading in cannabis, is also marketing in such a way that cannabis-containing products are popular or attract the attention of the young. So those are the kinds of messages that we need to filter around in schools, in any area where there's public gatherings, so that people know, yes, you can have access to cannabis, not in the a legal way, in the sense that the act in South Africa has not been passed as yet. And even when you have access to cannabis, you must realize that currently, as the law stands, it should be for medical use, and it should be for scientific use rather than recreational use.
Yeah, I'm going to labour on the point of young people because, Prof, unfortunately, it's them that believe that they are indeed invincible. Cannabis, for example, being laced in habli. We've often spoken about the adverse effects of habli, and a lot of our young people, a lot of them are smoking habli, and a lot of them are putting cannabis in habli, and a lot of them think, no, this is fine, it's just mixed with water, there's nothing hectic about it. How then do you start filtering even the message around how dangerous that particular concoction is?
I think we need to make the companies that make those substances and implements, we need to make them responsible as well. It should not be so easy for them to, pass on their product to young people. And then more importantly, that when you are going to be buying a packet of cigarettes, there's a health warning. And yet, as you mentioned, these other implements do not come with a health warning. So I do think that, it's going to be a huge societal intervention. It should not be just us, wagging a finger at young people. We should also be able to have parents who are able to ingest that message, who are able to then pass the message on to their children, but in a way that conveys concern about the effects rather than just, shaking our heads and saying, no, you can't do it because it's wrong. It's got to be something that we convey to young people in a way that also shows them the long-term effects, because we do know that when you're young, you think about the here and now usually, and you don't necessarily think about what will happen when you're 20, what will happen when you're 32. So I think we need to be able to link what the behavior is now with the future effects of, the unchecked behavior, including the risks, because in the end, if we don't do that as a society, we then carry the responsibility of making sure that when those very same young people are affected by the chronic effects, we then have to make sure that we've got the resources to care for them. And unfortunately, if you then, compare what we are facing in terms of the rate of use of cannabis, and you then compare the resources that we dedicate towards mental health, there's a mismatch. So we're saying as a country, yes, we are, open to young people doing this because this is something harmless. But then on the other hand, we don't make sure that we've got the resources to meet those risks. So I do think that we need to highlight the risks everywhere, including social media, including the internet, because that is exactly the same kinds of media outlets or media spaces that the companies who produce these substances also frequent to, attract more customers. And to them, it's actually about the bottom line is about the profits rather than public health issues.
We definitely hear you, Prof, and much appreciated for your time and your insights. Professor Zuki Zingela giving us the latest there in terms of how do we then start monitoring cannabis usage in this country.